come a long, long way. And we're very proud to have been a part of this movement pretty much since its inception. Certainly a historic day for us, and a historic day, I think, for the mental health movement in this country. We've come a long way. We've got a long way to go, and it's time for mental health. What I'd like to do is just take a couple minutes and share with you what we consider to be kind of our top 10 list for the first 100 years of mental health in America. And Dick, I appreciate the fact that we anticipate perhaps another 100 years, but on the other hand, let's hope that at some point there will no longer be a need for an organization like this, because we will have successfully addressed these issues in the broadest sense of those terms, and will be a healthy, unified society where these issues no longer are as pronounced as they once were. But our top 10 list, we founded in 1909. Beers, and William James, and Adolph Meyer founded what became the mental health movement in the United States. We have many of our friends and colleagues here today who represent the various components of this movement. And I think it's fair to say that certainly in my 30 years working in this business, we have never worked more effectively and powerfully together than we're working today. At the request of the Surgeon General in the United States, Mental Health America worked with the military to form the first neuropsychiatric clinics. I think people who know about the history of mental health in the United States realize that the military has played a very important role in terms of changing our vision about what's possible for people and how we structure and organize our treatment systems. And literally, we were at the vanguard of that movement. Mental Health America, along with the JCs, the Junior Chamber of Commerce, founded what was initially Mental Health Week. It has now become Mental Health Month. May is Mental Health Month. And that's turned into a very important tradition that's pretty much recognized and celebrated by all of our colleague organizations to bring attention to the problems that we all confront in this area. We helped instigate and support broad reforms of the state hospital movement, and of course that was the heart of Beer's aspirations, given his experience with the Connecticut public and private treatment system. We've been involved in reforming the state hospital system all along. As part of that, we were integral, along with many others in this room, in the formation of the Community Health Centers Act. We featured President Kennedy signed that act in 1963. And the act was really inspired by a vision of health promotion and prevention and establishing a community basis to keep people healthy, to keep them out of the hospital. We got mental health services included in Medicare. And just last year, we're proud to say that we as a community, again, were successful in removing the discriminatory co-pay coverages, which were not only discriminatory, but really kind of, to use a scientific term, really boneheaded in terms of providing disincentives for people to receive ambulatory Medicare mental health services in the Medicare program. We launched several years ago the campaign for clinical depression, which has turned into our current campaign for America's mental health. And again, with many partners, started a public education effort. This was in association with the NIMH and their Depression Recognition and Treatment Initiative. And we have, through polling over successive decades, demonstrated that we have moved the needle on attitudes toward mental illness in this country. And people, certainly with depression, depression has become so accepted that I remember I was at a meeting in Indianapolis, a mental health meeting in Indianapolis, and they were giving an award to a person who had been a leader in their movement in Indianapolis who had bipolar illness. And talking about her own experience of her illness, she said, that she had depression, but she didn't realize that she had a mental illness, like bipolar disease. We've been so successful, I think, in regularizing people thinking about depression that sometimes they don't even think of it as a mental illness anymore, and distinguish it in that case from bipolar illness. And that's one of our very proudest achievements. And you think about the issues of ignorance and discrimination and access, it's critical that we continue to work on that. We were part of a public policy initiative that resulted in the protection and advocacy movement in this country, the PAMI movement, which was a very important counterbalance, continuing this tradition of reform to improve care, give people who traditionally have not had voice voice, stature in these kinds of conversations. And importantly, we did that. We, along with many other groups, were involved in the Americans with Disabilities Act. You know, as we watch the Congress work on a day-to-day basis, and sometimes we wonder how something like the Clean Air or Clean Water Act or the Americans with Disabilities Act ever got through the sausage grinder of the congressional process. But in part, and when you ask people like from Senator Harkin what made the difference, they said it was thousands of consumers coming to the Capitol and demanding that something happen. And really touching in that case, I think Robert Dole and Harkin and others were touched by these stories and did the right thing in terms of the Americans with Disabilities Act. And then finally, last year, and the culmination of at least a 12-year effort since 1996, we passed the Paul Wellstone and Pete Diminishing Mental Health Parity and Addiction Equity Act. On October 3rd, it was passed by the Senate, sent back to the House with a small $750 billion amendment on it, which turned out to be the TARP program. We rang, that was I think the last time we rang the bell in our office. I think I put a hole in our wall actually. I don't think we pulled the bell far enough away from the wall. But this is the 300-pound bell. It's a serious piece of metal. Only to find out 20 minutes later that President Bush had signed the act. And ordinarily, of course, we expected it passes Congress, and then some days later, there's another event. But given that amendment, the $750 million amendment, he signed the act right away.